Hello guys, all right, today let's talk about AKT. Like you all know, my name is Unique. I'm one of the GP registrars. I'm a Nigerian trained medical doctor currently practicing in the UK, and in this channel I share information about my journey as a doctor practicing in the UK, as well as sometimes my lifestyle. So recently I've had experience with the AKT exam, and that's why I'm here to share. And I'll be dividing this video into 3 stages, but for today the first video we're going to talk about is how to boost your AKT score from either low score 60% and all that to whatever that is not a pass score to a pass score. At least above 80% is a pass score. So first of all, I'm a storyteller. I love to tell story with my experience. So you'll be hearing a lot about me, but that doesn't make it that I'm the standard. It's just using my own experience to give us example of maybe what I think we should do. So first of all, I started preparing for AKT. That's the first thing. Why AKT? First of all, AKT is one of the requirements to become a GP if you're doing a family medicine training in the UK. So when I entered into acute medicine posting after my psychiatric posting in February 2024, through the practice I noticed I had a lot to work through in medicine. And I felt like, yeah, exams can serve as an extrinsic source of motivation. So let me, try and start preparing for AKT, my first exam, to help me really update my knowledge. I love to be an excellent doctor. That's my watchword. In everything I do in life, I love to be excellent. So I felt like I need to update my knowledge, and that was why I started preparing for the AKT at that time. So I settled it into acute medicine post in February, and then in March, created a discussion group with some people that had the same vision with me, and we started preparation, slowly, gradually, trying to adapt to the NHS while doing the discussion. So we were able to get through the pass medicine because we were using pass medicine. Then went through, many people said the exam looked more like GP self-test, and we went through GP self-test. And then I attempted the exam in October and I failed. Now, why did I think I failed the exam? When I failed, what did I do? And that's what I would advise you to do. If you failed AKT and it's a bad news, cry. So first of all, I cried. I felt disappointed. Obviously, in the exam, I had my doubts after the exam that, I may not pass this exam, but I was still hopeful, but then I failed. So what happened is I had to go through, reflect on what happened, what really happened. And these are the things I have to share from my reflection. So after reflecting on the AKT, the exam itself, I noticed that I struggled a lot in the exam. I didn't have enough time in the exam. In all the exams I've been writing, I've never had time shook me so much. In AKT, I would say time shook me because I didn't know clues to question. Statistics wasted a lot of my time, a whole lot of factors. So it was both the knowledge factor and other factors, and a lot of organization factors I needed to work on. So what I did is that after crying, I told myself, I think I underrated the AKT when I was preparing it. So I went to make researches about the people that failed the exams, which I know might be what you've done too that brought you to this video. I got to hear people experience, and that really made me know that I was really going for war. So I decided to prepare for the AKT as if I'm going to war, to a battlefield. So the first thing I did was I decided to address my knowledge gap. And then this time I found a source, and that's the first thing I want to tell you guys. For you to prepare for AKT, you need a source. You can't just prepare for AKT the way you have prepared for other exams. There are many other exams I've written, especially I've written MSRA, PLAB, because those are the PLAB is undergraduate exam. You go through the PLABable, some app, and then you read the explanations, and you're able to because the questions are straightforward. They just give you a link to why this is the diagnosis, and if you've read, you're able to take it. That's different from AKT. AKT, you need to have the knowledge, and you need to be able to apply it. So the first thing is to address your knowledge. You need to read through all those knowledge once again. So I went through the system. My source was past medicine textbook. So I started going through not the past medicine question and answer like I did before, but then the textbook all through the topic. And then the topic that past medicine didn't specifically say, this is the first line management, second line management, third line management, I go to NICE guideline to go and check how NICE want the management to arrange. So I started using multiple sources. I had NICE guidelines with me. I opened, when I'm reading, I had the past medicine, and I went through the system by system by system. I'll copy and paste the 1 month plan, because I had read. When I saw the result, my result, I was able to reserve and thought I was going to do the April, but along the line when I was reading, I could make peace to why I failed the first one, so I went to attempt the exam in January. So the first question we're going to answer is, when do I write the exam after failing? You should write the exam only when you're confident. You could reserve immediately after failing, but don't be pressured to go and try that exam again when you know within yourself you are not confident, you are not yet very prepared. That's the first tip. I thought I was going to write it April, but as I started doing intensive reading, I found that I could do it January, and I went for January. So start addressing your knowledge first and start feeling confident to see things that, oh, was that why I struggled in the exam in the first attempt? Then, sorry, I've got things I jot down here, so I'll be looking at my jotter one like every now, here and now. So the second thing I did was to also tackle the statistics bit. I took time, studied statistics more, wrote down the formulas, spaced around my wall so I can be able to like reflect on the formulas, and then make it that at least once in a while I try to like pick the questions in statistics and solve. So I didn't finish studying statistics and put it to one side, but I keep practicing like the common calculations in between. Then admin, I studied admin as much as I could and kept it, and then left it to revise it close to the exam, then continue to address my clinical knowledge system by system. So after addressing the knowledge, then the first time, I went back again. So I was able to like address the AKT curriculum up to 2 to 3 times. So the third time wasn't as detailed as the first and the second. In the third time, what I now did was I picked only the important topic, as well as picked some AKT feedback topics to now concentrate and make sure I knew everything word by word. So I have all this to write here. What I need to understand is address your knowledge gap for AKT. Understand that is a postgraduate exam. You need to really understand that is a postgraduate exam. So it's not, nobody gives you a question and gives you clue to answer it. But if you really have studied very well, you should be able to answer most of the questions. And obviously there will be a lot of straightforward questions. Now, after that, what did I do? Why I know that I've addressed my knowledge gap? Because I noticed 3 things made me like fail the first AKT attempt. Apart from the knowledge, I think I had some form of knowledge gap. I underrated the AKT. I wasn't rested a night to exam. So a night to my exams, first of all, I did the afternoon booking. I tried getting an afternoon date, and a night to my exam, I slept properly. Ensured I slept very well, and then after sleeping properly, I woke up in the morning, and then quickly, refreshed myself, then revised pharmacology a lot. After revising pharmacology, I went through the picture courses. So 3 things happened that destabilized me in my first attempt. Was number 1, I saw a lot of pictures there that I'm not aware, a lot of statistical graph I'm not aware about, a lot of, just a whole lot of stuff that are like put me off balance. And then when I see those statistics, I always went to finish solving them before moving ahead. So I address them. I will explain to you how I address those. When I enter the second attempt, when I see any graph I know will take me time to figure out, I leave it till the end so I can be able to move as fast as, it's because the AKT is also testing you about time management. Remember what we do in the GP, you have a lot of patients, sometimes you have a couple of harmful stuff. You're able to prioritize and do things that are quite urgent and then move to things that are non-urgent. That's exactly what the AKT is testing to. So you could take your statistics there, some of the long statistics, there are straightforward statistics, calculate sensitivity, calculate this, everything is all there, just do it. But those ones that will tend you to figure out something should not stop you from seeing all other patients that are in that AKT exam. So see all of them as a patient. Will you stay with one patient until the rest of the time goes without seeing the rest of the patient if you had to prioritize your tasks? So that was what the way I figured out how to manage my time, and it worked for me, because when I finished my second attempt, I had up to 45 minutes to go back, quickly run through my questions, and then go through the statistics. So that's one of the things that I did. Then like I said, pharmacology was another thing I think I didn't revise close to exam. I had read it in the first attempt, but I didn't revise it close to exam. You need to understand that pharmacology, many things you've been tested as a GP will also be pharmacology related, because as a GP, you're either dealing with drugs, patient treatment, and all that. So you need to know a lot about drugs, their side effects. So I made sure that I revise them close to that exam. So make sure that you do revise a lot about pharmacology. If you're very busy, I would recommend people to attend courses. It's not a waste of money. If you think you're busy to read, if you're not busy to read, you could do past medicine, as long as you read past medicine textbooks properly, nice guideline properly, with your work experience. Because I remember I and my servants were discussing about gate plot at workplace. So I feel like if you're not very busy, you're able to like get through the AKT alone with your personal reading. But if you're very busy, you've got family commitment, and you just see that you're not able to get through on your own, then I recommend you do courses. OMA was very helpful. Even at the end of mine, I still enrolled to OMA crash course. The reason was because I wanted to like have idea of what other people had, other materials they had. So OMA, the crash course, what I found really very helpful in his crash course was the fact that he collected all the drugs and the side effects together, and that made revision of the pharmacology quite easy for me. Otherwise, the pharmacological section in past medicine was still okay, but I think OMA brought a lot of common drugs together, which was quite helpful. So the next thing I will talk about is do not prepare using question bank. This is another thing. This is another question, another important part. You might have prepared a lot of exam using question bank and reading the explanation. AKT is not enough, because it is only the thing that question bank tested you that you're able to read. What about other things that question bank might not be interested in? So don't prepare AKT using question bank. So what I did is that after reading a particular system, I test myself. Don't finish any question bank, because AKT is not any question bank. But you could test the knowledge of what you've read within different question bank. In my time, I had access to past test, on examination, past medicine, and GP self-test. And what I was doing is, when I finished reading, after reading, I test myself, pick some questions in past test, do it, and I'm like, yeah, I'm doing well. I pick it here and do it. So it's like while testing yourself to learn how to answer questions and how to reason. That's what the question does for you, and not really to use them and prepare for the exam. So that's something very important here. Then for the pictures, dermatology is really, really, helpful. Apart from for the exam, also for clinical practice, I use PCDS and Dermanet. They were really, really, really very helpful for me. A lot of pictures, like after using PCDS, like sometimes when I'm tired reading, I just keep scrolling through PCDS, and it really boosted my confidence. You can imagine, one of the days I found out why erythema multiforme is called multiforme. I could see the way they wrote it in the PCDS. They showed the multiple form, and I will never forget this in my life. So you need to really study for that AKT to pass. And also, ophthalmology, past medicine of ophthalmology was enough for me. I used it to go through pictures, but make sure that the pictures are very clear for you, because you will be tested with pictures, you'll be tested about medications, you'll be tested about pathologies. So you need to remind yourself about pathologies and symptomatologies and all that. So the next thing I just want to do is utilize your work. Work was also helped me. My supervisor was quite supportive when we come to work during tutorials. If I asked things about those gate plot in the system and all that, he made me understand a lot of things. We talked about menopause. One of the graphs came out and all that. So that's the thing. So there are a lot of things in the system 1 or whatever system you're using in the GP that sometimes also translate it to the exam. So what I would say that in summary, because the video is getting quite long, what I would say, what am I saying in summary? AKT can be quite difficult. There is no specific how many months you need to readdress your knowledge. If you failed AKT before, you need to first of all reflect on what has happened. Why did you fail? Don't say it is luck. I know luck can play a role in every exam, but I do not believe in leaving my exams to chances and luck. So I don't want you to say, oh, I just failed by 0.5 mark. It is luck. My question would be, why did I have to fail? Why did I not have to get that 0.5 mark correct? Why did it not happen? So I know luck play a role, but don't leave it to luck. There is something you can be. I wrote AKT twice, but I can tell you that I gained more than passing the AKT. I'm a better doctor. When I sit in this table and people come into me, things are better than it used to be before AKT. And that's for me, that's what I wanted. That was the reason why I wanted to even write the exam in the first place. And I'm glad I got more than that. So I know exams can be unfair, and I'm sorry if you had failed by a very small margin. That can really be quite painful. But I tell you the truth, take advantage of it. See it as a way to go get for information, go for that information, reflect. If you've studied really well in the first exam, then you may not need so much in the second exam. You should be able to get through it within a short time. If you think that you really perform badly and you need time to really address that knowledge, then give it more time before attempting. And I think that's all about everything I've written here. So about reflecting, do not prepare. Yeah. So I think that's everything I've written here. If you've got more questions, let me know. In the description box or in the comment section, I can copy one of my 1 month plan to cover the entire system. Bulky systems like endocrinology, we gave them 2 days. Another thing that I didn't mention is the importance of discussion group. If you found a discussion group, because you're working and studying, it can be quite tiring sometimes. But even when you're low, your discussion group partners can always help to keep boosting you up. So discussion is important. So I will encourage you, if you can, look for a functional discussion group so they can encourage you. I want to shout out to Dr. D in this video. He was because we had a group, but after my first attempt, I didn't feel confident coordinating the group anymore. When you failed, you tend to lose confidence. But Dr. D was just there for me. He encouraged me. You also need support of your friends and your family. I'll make another video regarding how I manage family, but I also want to give a very big shout out to my husband. He was really very supportive during my second attempt in AKT. And to all my children, I said, I give them, all of them. I'm sure they're not going to forget the word AKT in their life. They were quite very supportive. So another thing I'll say is it's good to speak to your family members, about the nature of the exam, for them to understand the challenge and support you as much as possible. I know I'm the one that would normally make my girls' hair, but during the AKT period, I had to pay someone else to do it. If there are things you could pay people to do, pay them to do it, so you can have time, buy time to study. So I wish you all the best. Everything. Do not be discouraged. Do not lose, hope on yourself, no matter how many times you've attempted that exam. Sometimes what has happened to you is when you have attempted the first attempt, to boost confidence will be difficult, and that makes you go fail the second and third attempt. So I want you to get up, ensure you are properly ready before giving the next attempt, and trust me, you've got this. I wish you the best and I wish you success. Bye bye.